So I'm talking today with Jamie Sprague from Manic Community Health Center. Here at the Thomas Crane Public Library, it's really important to us to help foster community and help people be as healthy and well as possible. These are really hard times, and we want to do what we can to help. We're not there on the streets really helping people, though, with their health needs. There's people in our community like Jamie who are doing that. So I'm really grateful, Jamie, that you joined us today, joined me today to talk about what you've been up to during COVID. So welcome. How are you?
I'm good. Thank you for having me. We love all the work that the library does, and we are really glad to be partners with you all over there.
I also have great respect for the work that you and your team are doing. So, and I know that you have a new space that you've moved into. That's super exciting. You guys were just starting to think about the move, I think, in March, and you've since completed the move. Tell me about it.
Yeah, so we have opened a new prevention and screening and outreach office at 549 Washington Street in Quincy. We do a lot of our outreach services out of there. Manic as a whole is a federally qualified health center that serves like a great scope of needs through primary care. We serve newborns to elders, and we have a lot of specialty services, one of those being our outreach team. So in our location, it's not one of our main clinics, but we're providing a lot of referrals there. Folks can walk in Monday through Friday from noon to 5 if they want to talk about services. We also have an outreach van. You might have seen it driving around town.
You may have seen you parked in our parking lot before. We've certainly enjoyed visits from you and your van before. So
it's become very helpful during this pandemic to be able to be mobile and meet with people outdoors, socially distanced, and we can provide things like Narcan training, free Narcan if you can't get it in a pharmacy. We give out harm reduction supplies, referrals to services, testing for HIV, Hep C, STIs, all sorts of services around town.
Do you have a schedule for the van, or how do people know where they might see the van? Is just kind of the best bet is to call or just drop by the office at some point, or luck out and see the van if you're out and about the city?
Yeah, so we're out daily with the van in the afternoons, but you can also reach us. I think we can put the number up at the end of this. If give us a call, let us know where you are. We can go to wherever you are. We're pretty flexible between about 9 and 5 Monday through Friday.
That's really amazing that you will bring services to people wherever they are in the city. And you obviously will come to people who are, in homes or staying with friends, but you'll also meet somebody if they want to in a park or, outside the library or something. You really go anywhere in the city. Are there limits to how far you travel?
Yeah, so we are mostly focused in Quincy, Braintree. We can provide some of our services in Weymouth. We can provide some of our services in Hull, but if you give us a call, if you're not from the area, or if you're in one of the other areas that we serve, we can always link you up with services in your area.
Have you seen a lot of people, worried about COVID? Are you doing COVID testing, or are you referring people for those tests elsewhere? And what can you tell me about the local experience with COVID here in Quincy?
I don't think anyone would disagree that it's a scary time right now. And, no one, it's hard to figure out what the resources are because they're always changing. We've been able to offer COVID testing at Manic in our North Quincy site since the beginning of it. You can go on the Manic website to fill out a form if you're interested in COVID-19 testing.
So you're providing COVID testing at the North Quincy site. That's awesome.
A lot of folks are getting tested preventatively, or if they've been exposed in North Quincy at 110 West Squantum Street. You do need an appointment. Okay. If you go on manicchc.org, there's a form you can fill out to schedule an appointment.
You did mention that, if you've been around somebody who may have been exposed, or you think there's some risk that you've been in an environment with people who may have had it, that's a really important time to get tested. But there are also some symptoms that if you're experiencing some certain things, what do you think is most important to look for, Jamie?
Yeah, I would honestly refer to the CDC website. They have it, all the symptoms written there and what to do if you think you've had an exposure. And if you've had a direct exposure, you might receive a call from a health department. So yeah, if you find that you match the criteria on the CDC website, definitely feel free to give us a call. We can, or send in the appointment form. We can set you up for an appointment.
And if you're having a hard time, accessing or even understanding the CDC site, you shouldn't feel bad. Sometimes these things are written in a language that we don't read every day or that we're just not comfortable with. So can people just give you a call if they're just not sure and feeling anxious?
Yeah, sure. They can call our front office.
I think that's a great resource that you can provide because, we can say, oh, it's so easy to go find out, but it's not easy for all of us. I totally understand that. Nobody should feel any shame. It's most important that we take care of ourselves and each other. So I'm so glad that you're helping people do that. That's awesome.
Yeah, absolutely. I think health literacy is very important. And sometimes websites like that don't make it the easiest for all of us to figure out what's going on. So.
And if you're new and you're already feeling a little down, it can be really, it can just kind of be too much to try to navigate. So let's talk about, that feeling of it being too much a little bit. I think that there are certainly, everybody that I talk to, it seems acknowledge that it's a day-by-day experience right now. Sometimes it's hour by hour. And we're all experiencing these kind of crazy, peaks and valleys of our own mental health. And it's not always easy to talk about. There's stigmas and there's ways that people address it in different ways. How you've probably experienced some people in some pretty deep valleys doing the work that you do. Tell me a little bit about, your kind of approach and how you hope people think about this.
It's a really isolating time right now. We hear a lot about the physical implications and symptoms of COVID-19 and how it can affect your physical health. But I think we're seeing more and more how much it's affecting everyone's mental health. Like, I don't think anyone is 100% okay right now. People are really stressed out. No one's schedule is the same that it used to be.
Yeah,
it's hard
for sure.
to have, right? It's hard to adjust to those sorts of things. And people are more and more isolated. There's no normality. And so like depression, anxiety rates are high, other mental health conditions, symptoms can increase under these conditions. And I think it's really important to have a community. And some people don't have that built-in community that others do. If you're living alone or, if you don't have somewhere to stay every night, it can be even more isolating, especially as communities are broken up.
Absolutely.
So I think it's important to reach out to, if not family and friends, to resources like the library, like MANIT, like our outreach team. Reach out to counseling services to, see what they can do to help.
I saw a great comic the other day, and it was talking about, and I won't go into trying to explain because I think if you've experienced it, it's best to experience these things native. But one of my favorite takeaways from the comic was that libraries can provide this with no shame. We have all these books, we give them to you for free. You can return them. We have all these resources. You can use them. You can not use them. We don't care what you do with them. We do ask that you bring our stuff back when you're done. But other than that, there is no shame. And the same goes for seeking medical help. I'm sure from you, if people want to listen, if they don't, whatever people are coming with, you've probably heard it a million times already before, and there is no shame in asking. People should feel no shame whatsoever about going out and seeking some help, getting some information, even if it's information they choose not to pay attention to. What's most important is that process, and then eventually we hope people will make those decisions that really help them take the best care for themselves. So.
Yeah, definitely. I think something that our program and the library have in common is that they're community services and spaces that people don't have to pay for to access. So if somebody wants to sit down and read, if they go to a coffee shop, they have to pay for a coffee, or there's issues with loitering and everything, or if they want to see a healthcare professional, usually you have to schedule an appointment with your doctor, have insurance and things like that. But when in both services that we provide, these are low barrier. Our staff is happy and willing to talk to anyone, regardless of their insurance status or anything.
There's a good reason we get along so well. We're very, very similar in philosophy for services there. Let's talk a little bit about kind of that dark side that's hard for a lot of people to acknowledge when it's ourselves, our family members, our friends who are dealing with addiction issues. I know addiction, it can be really, really hard to deal with. It's hard to admit that you're addicted to things. And then it's hard to live with that addiction. And it's hard to live with people with addiction. And there's a lot of things that, we want to think that, but for, it's my own moral will that's helped me, that's why I'm not addicted, until we're addicted to something.
Mm-hmm.
And, is it some moral failure, or is it, is there something else going on? And I certainly don't ascribe to the moral policing. I don't think you do either.
Mm-hmm.
Let's talk a little bit about the need for people to be kind to each other and to themselves and get help when they're dealing with addiction. Because I think we're seeing addictions, in these really trying times, they can push some of us towards addictive kind of behavior. And that can be scary and have a lot of really negative health impacts.
Yeah, I mean, you're absolutely right. I think it's very difficult for folks who, identify as sober. It's very difficult to stay sober in these times. I think like substance use amongst people who have substance use disorders and people who casually use substances has increased during this time. Mm-hmm. People are coping with a lot. And it is difficult to know that your friends and family might be going through a mental health struggle or struggling with addiction during this time, because everyone is going through a lot right now, and it's hard to support yourself, let alone family and friends. But a lot of communities are being separated. A lot of groups of people are being separated because of social isolation and, trying to social distance from people, which can be especially dangerous for people who use drugs. People who are relying on family and friends to check in with them and get them medical attention if they're overdosing. A lot more people are using drugs alone now because there's not people around. And in some spots, it's not because of regulations, you can't be with people. So if you do have somebody in your life, or if you yourself are using opiates, you can always come to Manit or give us a call, and we can train you on how to use Narcan to help reverse an opioid overdose. And we can also just link you with different support groups and everything around town, and recovery resources. If you are interested in any sort of drug treatment, whether it be inpatient or through medication-assisted treatment, which we offer, we can help you with those referrals as well. But it's definitely a scary time knowing that there are so many people that are struggling right now.
It is scary, and I'm really glad that you're there as a resource for people to be able to either walk into the clinic and just talk about these issues, and pick up the phone and talk to. It is a really isolating time, as we've said numerous times here. Something else that you and I were talking about is that, and I think is a natural segue here, that sometimes, if we're worried about how we're feeling, or if we're, we think we may be dealing with addiction, but we're not sure yet. And we're just, it's natural to want to explore your options and just see, all right, who can help me? It's a confusing landscape. That's something I think that you can do really well, Jamie. And I think that you do provide, is helping people who aren't sure what level of care they need, kind of explore and know, okay, maybe today you're okay, but if you're feeling, this way tomorrow, then you should really, do X, Y, Z. Is that accurate? Is that something, a role that you find yourself often playing?
Yeah, it is. We use a harm reduction model on our team, meaning.
What does that mean?
So we are a non-judgmental care team. We don't discriminate against clients, and don't think that sobriety is a requirement to receive services and be treated with dignity. We try to meet people where they're at whatever stage they are in their life, and we'll support them with their health goals. Whether their health goal be to enter inpatient detox or something, or if it's just to, use healthier ways to use their drugs for the time being. And we do have to have those conversations a lot with folks, trying to make them aware of all the different options, because I think some people think that inpatient care is the only option, and it's not realistic for them. Especially now, because people are scared to be around a large amount of people. So we can help you figure out what sort of options you have. And we understand that, like, something that comes up a lot, especially recently, is that there's a lot of trauma in our communities, and people who have used drugs historically have reported being discriminated against by medical providers. So obviously,
and that could be exacerbated if they're, you know, a member of another group, you know, if they, you know, are a person of color or indigenous person, women have experienced, you know, there's been a lot of people who have experienced trauma seeking medical care. So I think that's definitely experienced by people who have been, you know, had challenges with substance in the past, but they're not isolated in that either. And in fact, if you know, it could be compounded by these other characteristics of people.
Yeah, exactly.
You know,
right. Yeah.
Mention like sexual orientation or gender identity. Yeah.
Right. Yeah. Members of a lot of different communities, people who use drugs, Black, Indigenous people of color, LGBTQ persons, immigrants. These are all people who have historically been discriminated against in general and in medicine. And if somebody lives at the intersection of two or more of those identities, the likelihood is even higher. So we understand that and try not to force people into something that they're not comfortable doing. Of course, we know we have a non-judgmental care team at Manit, and we're very welcoming, but like, we understand that people are apprehensive of medicine in general. So we try to build.
All come with histories and baggage, for sure. Yeah.
Exactly. And, you know, it can be scary to be sitting in a doctor's office and
Absolutely.
see code or whatever. So our team.
I find my blood pressure is always highest right when I get to the doctor's office. I got as a white guy, I got to still wait for it to come down a little bit after I get there. So
Right. Yeah. It can be scary, especially when if you haven't been to the doctor in 10 years, you have no idea what they're about to tell you. Right. So yeah.
Especially if something's been bothering you and you don't really what you fear, like what could it be? And now it could be COVID. I mean, there's so many, like the fact that we're not all just going out of our skulls is rather impressive, I think.
Right. Yeah. That's why it's important to meet people before that point, because a lot of people don't get to that point where sitting in the doctor's office. You know, there's a lot of steps you got to go through, insurance, and building up that trust of a provider. So we can meet people in a non-clinical space, just out in the regular world, and work with them and build those relationships and eventually get them into care. We often hear from our clients, you know, that we will have seen for a year or two that weren't interested in any sort of care, but eventually they were ready to start getting a primary care doctor after so many years.
And you don't mind hearing from somebody numerous times before they're at that point. We know that it often takes all of us a lot of times of being exposed to something before we actually take that step to walk through the door. So
yeah, exactly.
People should keep calling. They shouldn't feel like, oh, I called them yesterday, I shouldn't call them and bother them today.
That's what we're here for. We're happy to help people navigate through these systems.
That's awesome. Jamie, thank you so much. Are there any closing words or thoughts that you'd like to leave people with today?
Please feel free to reach out to us or any of the other great resources around. We can link you with a recovery coach. We can link you with treatment or just harm reduction services or just someone to talk to. And you know, let's keep continuing to get through this together as a community, and hopefully our community will be stronger at the end of all of this.
Thank you so much. It's awesome work that you're doing. I know that, you know, telling people to be strong and feeling strong when we're not, I think it's okay to feel bad. You know, we have to all acknowledge and be kind and be kind to ourselves when we don't feel good. But that's awesome advice. We should stay strong. We will be stronger together, as we know from our history. And I do have faith that we'll come through this and be all much better at taking care of each other moving forward. We have to be. So thank you, Jamie. You're doing awesome work.
Thank you, Clay, and same goes to you.